daddy used to say, he said, I don't know what this boy going to be, but I know one thing, he's going to help people. He loves helping others. And that's what this job is all about to me.
Charles White may have been destined to lead Franklin Primary Health Centers as Chief Executive Officer in their mission to help the medically underserved. When he arrived in the port city from Birmingham in 1982, he personally surveyed his target community.
I actually walked around the community and canvassed the neighborhood and walked down Davis Avenue and walked through the community and talked to people and could tell that there are a lot of people here who certainly were at or below poverty. And that was probably what turned me on to see that there was a need here. It was about 5 of us, only 5 people when I started. And we actually had a $150,000 budget at that time.
Today, Franklin Primary Health Center Incorporated has a staff of nearly 300 at 15 locations in 3 Alabama counties, and a $20 million budget to provide health care to 40,000 clients in grassroots areas.
Where the poor are, the homeless, we treat them. We take care of the people who are on drugs, substance abuse problems. They're all God's people, and helping them, and then helping people who don't have incomes, who are low income and they need health care services. Primary care includes things such as family practice, internal medicine, OBGYN, and pediatrics. The numbers started growing, and where are these people coming from? See if we can take the services maybe closer to them. So then that's where we move next.
As part of the health care reform law that I signed,
the Affordability Care Act, which is what they infamously call Obamacare, is really now it's great for us because obviously it's talking about 30, including at least insuring another 30 million people. Those are people currently who are uninsured. And when I say uninsured, that means many of these people, in many instances, they are the working poor. They have jobs, but they just simply don't have insurance. I've watched the uninsured population grow from when I first started here from somewhere around 30%, to 40-some% in the 90s, and now we're over 50%, almost 6% of our total population is actually uninsured.
White says that the unemployed and uninsured folks need community health centers like Franklin.
We have too many people at this time that are utilizing the emergency room of the hospital, and that keeps the costs up. Many of the private sector physicians are beginning to say, we're no longer going to take Medicare, and for years they've said we won't take Medicaid.
Franklin's uninsured clients cannot pay top dollar, but I asked White about misconceptions that they are receiving free medical services.
A lot of people do pay. They pay according to their income and their size of their family. And so they do pay, and we do a very good job of making sure that they receive excellent health care, quality health care services.
A major challenge for White is the shortage of primary care doctors. He needs at least 4 right now. Competition from hospitals and medical students wanting to be specialists make it difficult to recruit. White says the new health care law provides money to help attract them.
There's a tremendous need for primary care, more primary care doctors. I think that that's another thing about the Affordability Care Act, to attract more doctors to go into primary care, and no one's addressing that.
The huge and growing uninsured population and seniors living longer and needing more primary care, White knows that he and Franklin will always be able to help.
It used to break my heart that many of our senior citizens were having to make a decision between whether or not they were going to actually take their medicines or get medication, or whether or not they could eat. It just was that bad. This is a ministry to me. It's ministering to the needs of the people in the community. It's a joy to be able to do that.
In Mobile, Eric Reynolds, Fox 10 News.